just to let us know how that went and what you learned, if anything, maybe from Camille's group.
So it was kind of fortunate that all of the people that were in my room were working on a project they had in common. And they really hit the ground running, and they made a lot of progress on a brand new logic model. So I'm hoping that they would be able to share it maybe.
Someone is sharing.
Okay.
Julia's going to share her screen, but I can speak to it just briefly because I know more groups will share out as well. But yeah, like Camille said, we all work at different places, so we wanted to see how we could work together. And so all of us mutually participate in the McKinley County Early Childhood Coalition, and that group just recently received a large grant from ECECD to expand kind of the coalition activities. But within that grant, it has some specific activities and outputs and outcomes like listed in the grant RFP. And so we kind of went off of that that grant proposal and kind of plugged things into the different areas. And I think it was there were some things that we kind of like, discussed as a group and plugged in there. Some was directly copied from the grant. Like some of the activities were kind of like listed in there. But it was interesting, I guess, working together. We all started at outcomes and worked our way backwards, kind of reverse engineered it.
Would you mind just go ahead and read through the long-term outcomes? Walk us through that.
Sure. Yeah. So for the long-term outcomes of this specific project, we're hoping to see kind of some sustainability, that there's long-term and varied funding sources and methods for the coalition. We've always had the goal as a coalition to see children, have kindergarten readiness. So that when we kept in there, that's not necessarily part of the grant. And then we also wanted to see families empowered, either on an individual or a family level, to participate in local governance or school decision making. Right now our coalition serves as a group that families can participate in or come to advocate, but we hope that they achieve skills and empowerment to be able to kind of like do that work on their own as well. And then the last one was systems building to create cohesive and equitable and effective early childhood systems that are accessible to everybody in our county.
That's great. And then if you could just run us through the activities about like the things that you will do to get there, that would be really helpful too, I think.
Sure. Yeah. And these are listed kind of like vaguely because we know like what they are. That was one of the last things that we got to, so we're kind of rushing. And these are taken mostly from the grant deliverables, the activities that they will be funding the coalition for. Mm-hmm. So one of the main things that we actually felt like we listed as an activity first, but then we realized was an input, was to recruit a coordinator position, a paid position for the coalition, who will be managing and conducting a lot of these activities in collaboration with other coalition members. But the first thing that we need to do is develop a community needs assessment, and based off of that data, then that will kind of inform the other activities around like family and caregiver education and outreach events and family leadership events that we've collaborated with Lois and her group on in the past. We would also like to develop a strategic plan. That one was kind of based more around like funding options that you saw in the long-term outcomes to have like more sustainability, as well as do some systems building and skill building work, again, with kind of directly with families. So I don't know if Colleen had any other things that she wanted to mention about the activities, but yeah, some of the things we had listed in activities we pulled aside and realized, oh no, wait, that's a human resource, or that that's to put in the inputs. So that was the last thing we discussed right before we came back to the larger group.
All right, well, great work. It's tremendous amount of, and I don't know how we managed to put you all together. That was very serendipitous.
Yeah, I think that's a good word.
we saw Erin available, so we pulled her in with us.
Yeah, I pulled her back to say, why'd you leave me?
Sorry about that.
Okay, no. It's great. It's great that you had an opportunity to work together. So are there any observations that you had about about, was there any, since you've already developed a grant together, did this add any value, would you say, to the way that you're thinking about your project?
Yeah, no, definitely. I think, we've just been looking at the grant, like the RFP itself, but being able to kind of see it in a visual like this,
Mhm.
it helps you organize your thoughts, and you have like a, less feeling of overwhelmed. You're just,
Good.
yeah, you're able to kind of walk through it a little bit better and understand each phase.
Okay, yeah, that's great. Thanks so much for sharing. Is there anyone else who has a logic model that they can share? Lost something here. Or any report back? Ranjana, we haven't heard from your group. Do you have anything to add to that?
Yeah, my group is in a different, I mean, there are different organizations, but many of them are in a situation that they have many parallel projects going on, and they were not able to decide which one to focus on. And so that's where their discussion was. And some of the colleagues were to be consulted, and they were not here. So they didn't have anything to share, although they started just some skeletal process, but they weren't sure which project they were going to go with.
That's a really good point, that you can have a logic model for a one project or a whole organization, and figuring out where it is you want to put your focus. That's a really good discussion to have. And that's a key thing in developing an evaluation, is, figuring out what area you're going to start with. I think that's a very productive discussion to have. Okay, so logic models, and actually, if Camille's group could show that logic model again, I want to take a look again at some of the outputs and outcomes as we go into the next part of the training, which will be to think about measuring things that may be hard to measure. So, Julia, would you mind sharing that again? Okay, so let's look at some of your, just trying to look at things that might be things that would be something that would be hard to measure. So for example, for a short-term outcome, you have increased parent and caregiver awareness of early childhood services. And then you have accessibility. So I would say those are two things that you might want to think about. How are we going to measure if we've done that? And the rubrics are going to be a way of thinking about that. I'm wondering also if the Department of Health group wouldn't mind, Arian, if you wouldn't mind sharing your logic model, so I just want to be looking for things that are hard to measure, so that you can have them in mind for the next part of this, of the training. Thank you, Julia.
Sorry, just got a funny phone call. Let me pull that up.
Arian, are you there?
Yeah, sorry, I had to go find the document.
Oh, thank you. Sorry. It was a classic Zoom pause.
Okay, so hopefully you can see it now.
Okay, so this is the Department of Health, the Maternal and Child Health Division. Okay, so I'm also looking at some of your outputs and outcomes that might be hard to measure. Okay, so this is the stronger partnerships I'm seeing under outputs, better interdivisional communication. So those are two things that might be hard to measure. And then some of these things are, you can think about reduction of maternal and pediatric morbidity and mortality. Those are things that you guys are great at measuring. You know exactly what you're collecting. I'm just looking for other things that might be harder to measure. Okay, so social support and services delivered for medical care access, that might be something else that might be hard to measure. So keeping those in mind, and if you've got a logic model that you listed some outputs and outcomes from, and you're looking at things that are like partnerships or other kinds of relationships that something may not come to mind immediately about how to measure them. This next topic is going to be about how to measure that stuff. So thank you, Arian. And I'm going to take the share away and start the, come back to this idea of rubrics. So let me go ahead and bring this to mind. So this idea comes from a book called The Social Profit Handbook, which we have found to be really a delightful read on great ideas about working in a nonprofit. And one of the ideas is that it shouldn't be not profit, it should be social profit, a different kind of profit. So we recommend that book. But the main part of the book is using rubrics. And so I'm just going to talk about two ways of thinking about them. One is it's a matrix that identifies criteria for success and describes levels of performance in relation to those criteria along the spectrum from poor to excellent. And then another way of thinking about them is that they're written descriptions of what success looks like. Okay, I'm sorry that this is fuzzy. It comes from the book itself. And the person who wrote the book was a program officer for a foundation. And so they created a series of rubrics that defined what was what were different levels of conducting their business, including a site visit. And so level one is what you don't want to see. You may have seen it, but you wish you hadn't seen it, but you know that it's possible that there can be this poor or unacceptable outcome. And so in this case, the program officer conveys aura of mystery about what they do and how they do it, asks questions that they should already know, gets frustrated, takes no notes, and kind of gives the impression that they're not really paying attention. So that wouldn't be so good. Then their acceptable level is that they go there at the time that's convenient, and they're wearing the right clothes, they have informed conversations, and they ask if there are questions. And then their standard, what they're really looking for is this list. So the visit is placed in a context, the past relationship is known and valued, knowledgeable so that they're asking the right questions of the right people. They are not having the same conversation year after year. They realize that there's a process happening, and so on. And then they have level 4, which is exceeding the standard. So in this case, the program officer intervenes and significantly changes the conversation for the better by getting to important things that need to be said, acts as a resource or consultant, connects group to others in a helpful way, helps brainstorm about the future in a productive way, and is very alert to body language and really trying to get a sense, really being there in the moment and communicating in a very deep way. So those are their levels. And let's think about why you would want something like this. And just like the logic model gets everything written on a page, a rubric does the same thing, especially when you're talking about what it is that you want to see in terms of outcomes or processes. Thinking about how to conduct a site visit, that's a process. So that would be an output. And rubrics are great for both outputs and outcomes. And so if everyone agrees, this is what it looks like when we're doing it to our standard, this would be like way above. And this is what we've seen. And we acknowledge that we've seen it, and we want to avoid being in that first level, the poor level of success. And then the second thing is that it is really a way to measure anything. Because if you have relationship building or partnerships as your output or outcome, then you know what you want it to look like. And you've been in partnerships that haven't worked out so well. And so you can describe those as well. And there's something very powerful about describing in words what it is that these things look like, that take them from being vague and feeling subjective to being not subjective. We all agree this is what a number 1 is, this is what a level 2 is, and so on. And then the last thing is that it allows you to really think about what you can influence and what you can control, because you're writing down exactly what it is that you have seen and what you want to see. All right. So I had shown this logic model from PB&J, and I had mentioned that for them, the heart-centered approach, like how they do their work, is very, very important to them. And one of the key features of their work is that being non-judgmental. That's a big part of their approach. And so we worked with them. Actually, this was in the fellowship. We had some students working with them, with staff members, to describe a rubric. So the first step is to choose something that might be hard to measure. So it could be an output, it could be an outcome, it could be a value. It's really anything that you care about that maybe you thought you couldn't measure. And then the second step is to name your levels of success. And so I don't even see the ones that were in the example I showed you, which were poor, adequate, standard, and exceeding the standard. Here are some other levels that might make sense for your organization. And then the third thing to do is to describe the things that you've seen. So level 1 is the worst possible scenario that maybe you wake up at night and are worried that it's going to happen, or that you've seen. And then level 3 should be your standard. It's the what you want to see in your organization. And then the fourth one should really be aspirational. And again, by writing these down, by describing them, even though your step 4 might seem like super aspirational, you can start to think about ways to get there. So that's the ideal. And here's the rubric that PB&J came up with for non-judgment. And so you can see that they divided into staff behaviors, staff reactions, and staff member, but what they might actually say. And again, what you're trying to do is give a concrete description so that when you see it, you can recognize it. And so the weak column, unfortunately, they reported that they had seen this, is if you're trying to be non-judgmental, the week is actually judging people, treating them as if whatever they did in the past is still relevant, refusing to work with families, and being condescending, educating them in a way that makes them feel stupid. The reaction might be not wanting to, trying to get out of a situation, not wanting to be in the house, expressing disgust, being condescending again, and just saying, belittling others. And so the kinds of things that they don't want people to say are these kinds of things. You shouldn't have worn that. Judgmental, you chose drugs over your kids, and so on. And then the developing is, you can see looking a little more optimistic. And then the achieving is really the standard. So doesn't hold clients' past against them, doesn't look at the past, listens with empathy in an effort to get to know the client, educating clients in a way that empowers them. With a reaction to domestic violence is no victim blaming, open to learning, praises efforts and hard work. So looks for the assets, and thinks about failures as part of progress and conveys that idea. And then their exemplary has, and I don't know if this is aspirational, but this is their exceeding the standard, I guess. And you can see that if we look through of judging of what someone is wearing, from you shouldn't have worn that today in the week, to do you think it might be too hot or cold for that today, to I like what you're wearing, to pointing out like something really positive about that. So I hope that gives you an idea of how something like non-judgment, which you could be like, well, is that a yes or no? There are very few things that are yes or no. Really what it is there's different levels of success. So I already said that, so I'm not going to say that again. But we have found that these having a rubric, in addition to just the benefit of having it, you can use it for observations where you decide what level someone is at. For example, if you're training a staff member, you could evaluate yourselves in terms of what your partnerships look like if you have the different levels. I'm trying to think what the other ones were that I pointed out. If you're looking for parent or family engagement, you could think about different levels of family engagement. So that's what we'd like you to work on for the next work period. And again, if you go to that that link, we've got the rubrics. So all of this information, I think this might even have a longer list of how you might define the levels. Here's another example, again, from that YouthWorks project. And so this was a little harder for them because they were imagining what it would be, because it was planning a project. And so the McKinley group, you might be in this situation where you're like, well, we haven't done it yet, but this is how we can imagine the different levels. And so these are broken up into, these are some outcomes for youth. And so you can see that going from, and they had this idea with Island, Trail, Route 66, and Yellow Brick Road about how a youth might define their own goals. So not understanding what they are, having them in mind, and knowing what they are, knowing what your goals are, and then having written down short and long term. And I see that Deborah raised your hand. Do you want to unmute and ask your question?
Shoot, let's see. I can't get to my screen.
Oh, did you lose us?
Yeah.
Just if you can find the Zoom button, we should come back.
Oh, that's all right. I'll put it in the, sorry. I can't get rid of the screen share.
Oh, that's my bad here.
Oh, yeah, okay.
That was me.
So I think you answered my question in that last little bit, because I was thinking that both the first two examples are internally oriented.
Mhm.
And David Grant's thinking about how their program officers perform for the foundation. And in this, the second one, their PB&J is thinking about how well their staff perform. You can use rubrics, though, to create levels of awareness about the participants you're trying to impact as well.
Absolutely, absolutely. And it's interesting because the David Grant book kind of says, well, these are for internal processes. But when we read his book, we're like, oh, these are totally for outcomes as well.
Oh,
You know,
okay.
any outcome that is something about, empowerment, engagement, partnership, any of those things you can describe of like weak, okay, great, and, exceptional. So absolutely.
Okay.
And I'll go back to some of these other ones. So like access to resources. So the first one is that you don't have access. And so these are, again, these were also developed by youth who are going to be participants, but really thinking about different levels of what it would mean. And then this last one is youth empowerment. And so this would be that in that space, youth are told what to do. Youth are themselves and they don't have to follow others. And then going up to empowerment and helping others achieving their goals. So that's an example of some outcomes that you might be looking for. And then we've provided you with, you decide what you're going to call the levels, and then you create them. Can there be more than 4? Yes. But if we're going to do less is more, 4 is good. You don't need any more than 4. And so what we'd like to do now is break. No, let me just make sure that I know what we're doing now. I want to keep up with, sorry, I lost. Now I'm in my way to, let's see. Okay. All right. So what we'd like you to do as a group, if you're working in a group, and on your own, if you're working on your own, is to try one outcome, output, or value that you care about and run through the guide. And we have from 350, I went a little over there, 350 to 420 to work on that rubric. And the same breakout rooms are available. You'll have until 420. And then we'll be meeting in the small groups. The next time you meet with your small group, be sure to sign up for an appointment. And yeah, so let me stop the share, see if there's questions. And I believe that the breakout rooms are still available. All right, so let's see if there are any questions about, we're asking you now to do another exercise, which is to work on a rubric.
So we'll find the model for the rubric at the same URL that.
Yeah, and maybe Caitlin can
address-
drop that into the chat again.
Okay, yeah, thanks. Yeah, great.
All right. So let me just see.
Can you hear when it says recording in progress?
No, maybe because I'm a host, it doesn't.
But
Oh, it's
sometimes it
recording.
does, right? In meetings. Okay.
You're recording?
Yeah.
The participants can hear it.
Oh, you heard it, Mary?
Yeah.
Okay. All right, are we all back? Let me just see. Yes, I see all the facilitators. Okay. Well, so let me just let you know that we are at the end of the afternoon, and we've just got a quick debrief and then a couple things that are coming up. And so let's start with the debrief. How'd it go? Did we get some rubrics on some, did we figure out how to measure some things that were seemingly unmeasurable?
I'm gonna put the UNM on the spot on this one because they had some really good insights on the process of creating the rubric. Claire Lewis.
Does that mean me or did that mean somebody else jumping in? I guess what I will say is it really helped our team notice the back and forth between what we thought was an outcome actually was an activity toward trying to map out, you know, a 1 to 4 set of measures to clarify. So there was a lot of back and forth. And it also helped us drill down to realize things that we've built into our approach, the work that we do also can get fleshed out across the rubric. And we loved listening to Colleen, Mary Ben, and Erin because they're partners with us. So what they're doing on the ground, we're working to try to support statewide amongst 15 communities. So I just have to say, Mary and Colleen and Erin, your presentation and the concreteness and how fast you rolled it off just really blew our minds. I don't know if that's what you wanted me to say, Claudia, but that's the truth.
Yeah, thank you.
So is there a rubric that, I mean, the people that Lois just mentioned have that they might want to share?
Not to put people on the spot, but Julia has it on her laptop. And then I think Erin did a really good job of summarizing it. I don't know if Erin's still able to do that right now.
Yeah, I can talk. I need a visual.
Okay, it's coming, it's coming.
Okay, thanks. Okay, so we wanted to focus on family participation, and for our rubric, like assessment categories, we decided on the positive language of emerging for 1, developing for 2, achieving for 3, and extending for 4 to really promote just continued growth. So under emerging, we decided that we want to, or the signs of emerging are attendance to monthly activities, like misses several months. We have at least monthly coalition meetings. So kind of quantifying that. Little to no attendance by some groups. Meetings in English, so not really reflecting the working and languages spoken there. Discussion of providing devices for remote access, but not getting any further than that yet. And depends on direct invitation to families to join activities. So really starting the first steps to to really get more families involved and participating, but it's really dependent on members of the coalition directly inviting families. And then families are in a passive role, just listening, and meetings being held in person in Gallup, not reaching beyond that yet. So that's emerging. Then developing, the kind of the signs of that would be consistent attendance of core group of people or members, but just kind of that core group. 40% Native participation, so quantifying a little bit more representation of the population of the community that we live and work in. Then devices purchased but not provided yet, so making further steps on that. And then some families with disabilities attend occasionally, so again, making progress there. And then public relations in place for advertising activities, so starting to get the word out, not just relying on direct invitations from current coalition members, but a concerted effort to really publicize. And then families sometimes share, so not just listening, but starting to get in, participate a little bit more. And then having meetings in our coalition meetings in Gallup and a hybrid option as well. So kind of branching out to be able to reach more people and get more people involved. And then achieving would be 60% Native participation and a little bit more increased representation of the population in our area. Families, so whether that be having meetings take place in person in access for people with disabilities, however the need, or having and it kind of relates to the next one, which is translation services present, but having if we're on Zoom, having the closed caption option turned on, even though that's not perfect, but it's better than nothing. So just really meeting the needs of families who are getting involved. And then regular attendance by families with disabilities, so that kind of ties in there too, but seeing regular attendance there. And then 50% distribution of devices, and most used to attend meetings. So the devices are getting distributed and being used to actually attend the meetings. And then families consistently share there too. Family recruiting other families. So not just relying on the members of the coalition to provide those direct invitations and pull families in that way, but having families start to take initiative and get other families involved. And then meetings outside of Gallup occasionally. And because it's McKinley County is a wide area and a very big area. So getting out there in the community to meet where other people can attend more easily. And then extending diverse family attendance reflects their population demographics. So more specifically, 80% Native American, 10% Hispanic, 10% white, and Arabic speaking, because we have a quite a large population of different groups in our community. Then leading meetings in other languages with translation to English, which would be, I feel, almost cutting edge and reflective of our community, because that's not done very commonly, at least in my experience, in my 15 years here in Gallup, but really meeting the needs of the people attending. And then completed with 100% completion, the distribution of devices for meetings for remote access, and those who need them, use them to attend. So make sure that people are making use of them for the intended purpose too, or the primary purpose, I should say. And then support families to lead meetings. So really getting a lot more family participation and trying to kind of focus on sustainability there too, and systems process. Families are actively involved in planning meetings. So again, that sustainability and the systems process there. And then rotation of locations around the county, making sure that we can be present, and that goes along with the publicity too, being present and out and about and around the community.
That's
what we
great.
came up with.
Great. Thank you so much. And I'm gonna steal the share because we've just got one more minute. So great work. I'm really excited to see how you have defined family engagement. That's fantastic. So just in the last minute, just want to let you know, remind you about the Echo. You have been added to the listserv, so you will get an email the week before. And just so you know, here's the schedule of what it's going to be. And I want to thank everybody for participating. I hope you've had a chance to sign up with your facilitator for your first one-on-one consultation. If not, hang out. If you can hang out another couple of minutes, we'll get you signed up. And yeah, so thank you, everybody. We're really looking forward to working with you over the next year. If you haven't had a chance to sign up, if the facilitators can, go back into your room and go ahead and arrange the schedule. That would be awesome.
Thank you.
There's no breakout options for us again. I don't know if Caitlin needs to open them.
She did it.
Should be open.
Thank you.